But the big story this week is the beginning of vaccine rollouts here in the U.S. The first patients in New York State have been vaccinated with the Pfizer and BioNTech vaccine to protect against COVID-19 infections. And in New Jersey, we will begin to see the vaccine rollout starting tomorrow. And that is where we begin our conversation during this hour. We're joined now by Yahoo Finance's Anjali Kamlani, as well as Dr. Assad Elnahal. He is the CEO at University Hospital in Newark. Dr. Elnahal, great to speak with you once again. I'd love to just begin with where your hospital system stands with respect to New Jersey's rollout, which again, as far as I understand it, will begin tomorrow, and what you are anticipating over the coming weeks inside your system.
Well, we just had a very exciting milestone today. We got the first shipment of the Pfizer vaccine, only one of 2 hospitals to get it today. And it's a really exciting moment for this community, for this hospital, and for our healthcare heroes. We've set up essentially an assembly line system in our medical school building attached to the hospital. We had to find a very wide open space to essentially set up 4 lanes where folks are going to be vaccinated starting tomorrow morning. And Governor Murphy is going to be joining us for the vaccination of the first healthcare worker in New Jersey. So we have the vaccine, it's in our ultra cold storage freezer, and we're ready to administer it.
Dr. Elnahal, I know that there's a lot of questions about who will be receiving the vaccine. I know that healthcare workers, especially those on the front line, are part of that. Do you know if the administration will also be receiving them, individuals like yourself, in order to help with vaccine confidence?
We're sticking very close to what the CDC and the New Jersey Department of Health identified as the first folks up for this. And so we're sticking with folks who normally interact with patients, not just physicians and nurses, but also unit clerks, environmental service workers, food service workers, anybody who has the opportunity to be exposed, really anybody who interacts with patients and their families as part of normal course, which actually is over 2,000 people on our campus. So there's going to be a lot of people first in line to get this vaccine.
And Dr. Elnahal, it's Julie here. Do you have doses for all of those people as of yet? What's the deployment process look like? And I'm also curious, we spoke to a guest earlier who pointed out that there is some chance of side effects with the vaccine, fever, for example. So are you going to need to do it staggered in a single department, for example?
Yes, so we have about 3,000 doses in the first shipment that should cover us for the first injection of the vaccine into our healthcare workers. But remember, this is a 2-shot regimen where folks have to come back 3 weeks later to get their second. And so we're going to be getting shipments every single week until we end up vaccinating all of our healthcare workers. And then we're going to be tasked with vaccinating healthcare workers in the community, your community physicians, your community nurse practitioners, nurses, et cetera. So all of that is happening in the coming weeks. And yes, we have to be careful about how we vaccinate and how we stagger the scheduling of the vaccine. We don't want to, for example, vaccinate every staff member of our intensive care unit on the first day, because side effects can be pretty significant, none of which are severe, but fatigue, muscle aches, et cetera, are quite common with this vaccine. And so folks missing work 1 to 2 days afterward is not unexpected. So we have to be careful about making sure we maintain our staffing during this second wave. Remember, we're still getting COVID-19 patients coming in, and these are critical staff that are taking care of them, and make sure also that our staffing is not compromised in the process.
Dr. Elnahal, I know that also, we have Moderna's hearing this week as well. Are you planning the vaccinations in accordance with the anticipation of another EUA, or are you doing it with the idea that only Pfizer exists right now and just relying on that?
Well, the New Jersey Department of Health is being very careful about how they're allocating these vaccines. And one thing they're doing is making sure that every facility that's getting a vaccine only gets one type as we start, because they don't even want to give the chance for a facility to give one type of vaccine on dose 1 and another type of vaccine on dose 2. That would actually be not consistent, of course, with the clinical trials and confer an unclear benefit on people. So we're going to be sticking with the Pfizer vaccine in the coming weeks. And when we are told that we can receive the Moderna vaccine, we will be able to do so. One thing to understand about the Moderna is that it does not require the ultra cold storage of -70°C. It can be stored at warmer temperatures, which means it can go to more places if it does get the EUA this week. And we're all hoping that it does.
And Dr. Elnahal, last time that we spoke to you was just before the Thanksgiving holiday, and we saw cases on the rise, nationally, but certainly the outbreak in New Jersey and the New York area has continued since then. What is the state of your hospital system's capacity, and what trends have you seen, in your emergency rooms and just in your, point of care locations as it relates to the outbreak that we know is ongoing, certainly in the county, Essex County, where you are, but broadly in this metro area?
Well, we have started to see a very slight uptick in hospitalizations, now 2 weeks plus after Thanksgiving. And we were looking at this very closely to make sure that we weren't seeing a spike due to household gatherings, et cetera. And thankfully, we don't seem to be seeing a very steep increase. But of course, it's happening as cases continue to rise. We still see the doubling time in New Jersey at a place where we don't want it to be, and the rate of transmission is also high as well. So we are still in the thick of this second wave. We cannot declare victory, even though we have not been overwhelmed with patients yet. And we are planning for all scenarios as we go forward.
All right, Dr. Sharif Elnahal, CEO of University Hospital in Newark. Doctor, thank you so much for joining the program. Have a great holiday, and we'll talk to you next year.
Thank you for having me.